Acosta. Perfect. Hi, everyone. My name is Jorge Acosta. I'm the Nursing and Allied Health Counselor at Citrus College. My primary focus is nursing, but I also assist in what we call guided pathways under the health science professions. So I'll be covering a bit about our health science programs, but also with more of an emphasis in nursing, as that tends to be a very popular career major at our campus. So what you'll see on the screen is images of our students in our programs at Citrus College. So this is an overview of the health science programs that we offer at Citrus College, which I'm going to focus on today, and that is our Registered Dental Assistant Program, RDA, our Emergency Medical Technician, commonly known as EMT, and health sciences, we use a lot of acronyms and abbreviations. Certified Nurse Assistant, CNA, Licensed Vocational Nurse, LVN, and Registered Nurse, which is our most popular RN. We also have some other tracks underneath some of these, and that means they're not necessarily their own or commonly or regularly offered tracks, and that is Homeland Security and Home Health Aide, which will actually be offered based on demand. So those programs are very unique, and there's some of these. And so Emergency Medical Technician and Home Health are connected with our faculty, but is not always as available depending on how much of a demand there is for students enrolling in those courses, similar to Home Health Aide with our CNA program. But if you have any questions about those, I'm happy to answer any of those after my presentation, as we'll have time to answer any questions you may have. So the first program that I wanted to go over is our Registered Dental Assistant, or RDA that we call for short. And that's our program at Citrus. It's a one-year program. It starts twice a year. These health science programs, it's really important to keep in mind that it focuses on theory, which is the traditional classroom setting, but also the simulation lab, which is what you see here, which is for our dental students. It is what you would see commonly in dental offices. It's creating that exact environment. And then they also then will go outside of the campus to do their clinical hours, and in this case in dental offices, to meet the required amount of hours in training to be able to sit for the state and national certification exams. So it's important to know that for all these health science programs, it's going to be a combination of theory, which is the traditional classroom, the skills lab or simulation lab, the actual hands-on training before the third component of clinicals, where you practice with live patients for your required hours or training to sit in for the certification. And the cost of this program is a little over $3,000 for the one-year program. This program is very flexible, meaning we have students that are on a part-time basis, full-time basis, of course, depending on students' circumstances outside of school, that can really work out for a lot of students. As these programs, as this semester was a transitional semester of returning back on campus, more and more of these programs are returning fully back on campus. And so there may be some components that are hybrid, such as the theory, but we have seen that most of our health science programs have returned fully. And these were some of the few programs that were on campus during the pandemic because of the required hours that are needed for the certification exams for their respective program. But that's our Registered Dental Assistant Program. You may see these across at different community colleges, private trade schools, and so forth. You know, they should, when researching these kind of programs, it's important to see that they're accredited, especially by CODA, which is the accrediting body for these dental programs. And a lot of these programs, including ours, really helps with job placement. So a lot of our students will find work, especially in places where they did their clinical practice a lot of the times. And so those things, those relationships and connections are built in with these programs, and Registered Dental Assistant is included in those. So a lot of our students will have jobs lined up after they complete their certification exam. And again, a lot of them could be from just their placement in clinicals, where they were able to build that connection and demonstrate, you know, their proficiency in their respective profession. But again, it's a wonderful starting point, you know, for some students, and for others, this could be their career. It can vary. You know, we have some students who may pursue eventually dental hygiene, or a further advanced profession in dentistry that will require a doctorate at a professional school. So, we see a variety of students enrolled in our registered dental assistant program. And you'll see there, that's our students that were in the program. And a lot of our health science programs, they use different color scrubs to designate the different programs. We'll move on to the emergency medical technician, or EMT as it's commonly referred to. The EMT serves for a couple different purposes for some students. It can be an entry-level profession to get a sense of what health science field they would want to. We see some students who express interest in fire tech, eventually, pursuing fire academy. And so EMT is a common requirement for that. But we also see a lot of our pre-health and pre-nursing students pursue EMT as a way to gain experience, network, and help explore whether or not, a certain health profession is the choice for them. The program itself is just 2 classes. It can be done as short as 1 semester, which is 16 weeks, or 2, because if a student prefers to, stretch it out, that's perfectly fine. We, in our program, admit the students twice a year. Again, it's hands-on. So in the case of EMT, it's ride-alongs. And this program will prepare students for the California and the national certification exam. And you'll see that there the total cost is a little under $1,000. But I want to stress that a lot of our students in these programs receive financial aid. And so that covers a lot of what that total cost is, because a big chunk of the cost that you'll see for these programs is the actual units or credits of the courses, so the actual classes. So what that means is if a student's receiving financial aid for tuition, they will see a lot of these costs waived. And so we see a lot of that of our students, and they may even receive additional financial aid that covers their other additional costs for the program. So just something to really keep that in mind when you see these costs for the program itself. But this is a wonderful opportunity, EMT, for students to explore healthcare careers, especially depending if they're doing non-acute or acute setting work, as they interact with individuals who are either paramedics or advanced health professionals in hospitals or in skilled nursing facilities. They start to explore and see what may be of a fit or what they may be of interest in the health profession. So it's a wonderful opportunity for students, but it's a quick program. It's an intensive program. Sometimes there's shorter programs, and sometimes there's a little bit longer programs in EMT. They're governed by a lot of different, not governed, but they can be offered in a lot of different settings and types of institutions. So you see a lot of varieties in the way it's offered. But for us, it's a 1 semester, 2 course sequence. So now pivoting to the CNA, or what we call the certified nurse assistant, you'll see here, again, our students are in different color scrubs. Our CNAs are in white and black scrubs. CNA and EMT, as I go back to the EMT slide, I want to stress is when students are interested in nursing and they start exploring nursing programs, you'll see more and more across all the information that's in their respective websites that not only are things like academics, GPA, test scores, and things like that will be important, but also some certification, healthcare experience, volunteer experience. And some of the most commonly referred examples are these 2, EMT and CNA, because these are some of the few certified or licensed entry-level health professions. There's a lot of health professions that are not certified. They're not governed by any body or accrediting agency, where they may seem to be doing a lot of what we are going to talk about the CNA or the EMT do, especially in non-acute settings, but they receive just training on the job site. But nursing programs really stress about, awarding and giving students extra consideration when they complete such programs as a CNA or EMT program. So I really wanted to stress that while I'm on these 2 pages here for the CNA and EMT program. So it's a good investment, not only to help, get assurance as to whether this is something you wanted to pursue or pursue something in health sciences, but also it will help for any future nursing applications or other similar health fields to get this kind of certification and then even possible healthcare professional experience. Now, a little bit more about our CNA program. Ours has 3 start times. It's 1 class only. It can run from as short as 6 weeks in the summer to 8 weeks. So it's a very accelerated program at our college. It runs 5 days out of the week. It is from 7 a.m. to 2:30 p.m. And again, like our other health programs, theory, skills lab, and then clinical practice offsite at either skilled nursing facilities or hospitals. And that will allow students to then sit for the CNA state test through the Department of Public Health. And you'll see there that the total cost is a little over $300. But again, a lot of our students receive financial aid, and that may cover the cost of the class. But regardless, it is still very low cost compared to private schools that can be upward in the thousands I've seen for a CNA certification. So it's a great way to start your exploration into nursing. It's not a huge time commitment, as some of these programs can be as short as a month and a half to 2 months. So it can be a good way to get, again, some assurance as to whether or not this is something that a student would be interested in exploring and be interested in nursing. So it's a really good way to do so. And a lot of the times we see now that CNA certification is a requirement for the next program, licensed vocational nursing programs. And so a little bit about, let me go back to the CNA, that this becomes a requirement because CNAs learn the foundation and are taught the fundamentals of nursing. They do a lot of the patient care, repositioning bedridden patients, restocking. They're not necessarily administering medications or handling too much equipment, but they're learning under the concepts of care plans and concept maps for nursing, which is a foundation and it's going to be very significant in any registered nursing program. And that's why you see CNA a lot of times as a requirement for LVN programs, but also given extra consideration for applications for registered nursing programs, because it's one of the few, again, entry-level health professions under nursing that receives the training under the theory of nursing. So that's very key. So for vocational nursing, I call them a little bit of jack of all trades. LVNs do a lot of similar things as RNs in terms of patient care, bedside care, but they do a lot of administration, care, case management. They can work in skilled nursing facilities, home health, hospitals, school districts, urgent cares, from small clinics to large health organizations. You name it. LVNs can work in a variety of settings. They are administering medication, they're operating equipment. They just don't have all the authority and responsibility as an RN in terms of evaluating everything in a patient care plan. LVN programs, because of how much they do, are going to be longer in length. So these programs are typically a year, give or take. Our program admits twice a year, and LVNs are governed by, it's going to sound weird, the BVMPT, the Board of Vocational Nurses and Psychiatric Technicians. And so that is the governing board for this profession. They have their set standards and requirements. Ours is going to be a one-year program, just like many are, but our program requires CNA certification. The program finds that foundation in the CNA training helps with students in the LVN program, especially as they practice in the simulation lab. As you see in the photos here, those are our former students in our simulation lab with those mannequins, and those mannequins are very high tech. They are essentially able to demonstrate different symptoms. We have different mannequins with different, from newborns to elderly, the elderly. And so you will see a lot there as you receive your training. And so it's a very good experience before they go out to the clinical sites of hospitals and skilled nursing facilities. Once completed an LVN program, students are able to sit in for the NCLEX VN, and that's the national and state exam, because it's the same exam across. It's just in California, we call our vocational nurses LVNs, and other states it's PN. So it's very, very different, but it's essentially the same the way they call it. But it's a great way, LVNs, for students to transition eventually to registered nursing. It's not necessarily an option for everyone. It's a lot of times students who need to find themselves wanting a way to support themselves, and explore a network. And sometimes this is their end goal. And for others, this is a way to transition into registered nursing. So it is a way to transition and link into a registered nursing program. I would not say it's an easier track, but it is one option towards registered nursing. Sometimes there is a little bit of a misconception that by completing an LVN program, getting experience, you have it, it's easier to get into an RN program. That is not necessarily the case, as I'll get into when we talk about registered nursing programs. So for registered nursing, which is the most commonly known and the most popular of our programs at Citrus College, especially under health sciences, but it's these health science programs is one of the few that are very career specific. And so because of registered nursing being, commonly known, especially from the last 2 years during our pandemic, but, popular culture, TV, movies, and things like that, a lot of students express interest in this. But it's very important to know that there's registered nursing programs everywhere. It's hard to ignore all the billboards, the commercials, the radio ads from all these different registered nursing programs, whether they're community colleges, private schools, and things like that. And so even though they're registered nursing programs, there's a bit of differences among those different pathways. So it's very, very key to understand that they all won't be the same, even though they say registered nursing. But at community colleges such as ourselves, Pasadena City College, East Los Angeles College, and so forth, these are going to be ADN, which is an associate degree of registered nursing. It is the same licensing exam and license as a student that would complete a pre-licensure BSN program at a Cal State, such as Cal State LA, or a private like Mount St. Mary's University. So it is a little confusing because in the state of California, you can sit in for the RN license with an ADN program such as ours, or a BSN and now an entry-level master's, but those are the two most common, the ADN and BSN. And even though they're two different degrees, you're sitting in for the same exam. So our students, after completing our program at Citrus, will be a licensed registered nurse through the Board of Registered Nursing with the state of California, and they'll be able to work on a lot of different settings. And so it's a wonderful opportunity for students because it's a highly in demand, and we're going to continue to see these professions in demand just because of a lot of different factors. Our program will essentially start once a year. So I like to tell everyone about our program. Ours is a younger program. It's a much smaller program for us. Compared to other schools that have been more established and have longer running programs such as PCC and so forth. It is impacted, and that's very important to keep in mind. Impaction means that we just simply receive more applications than spaces available in our program, and because of that, it is competitive. So registered nursing programs at community colleges will be competitive because of the cost. You'll see there, it could be $4,500 for LVNs who want to apply for the RN to up to $6,000, and that is for the 2-year program. So that is very cost effective compared to private schools and traditional BSN. And because of that, we see a lot of applications that we must review. And that's currently what we are doing right now is we just closed our application period and we're reviewing applications for this upcoming 2022 cohort. Registered nursing programs, it's very important as a pre-licensure program that you don't specialize in an area. You will receive rotations in training areas like medical, surgical, pediatrics, childbearing, maternity, mental health, psychiatric nursing, gerontology. And so you get trained in a variety of areas and populations so that you are able to serve a variety and work in a variety of settings after the RN program. It is post-bachelor's where you can typically specialize, whether that's a certification or a graduate degree. But in your pre-licensure program, that is where you will rotate across different areas. And we even see students that come in and express interest in OBGYN area, but then find themselves got interested in gerontology with older populations or even psychiatric nursing. And so you just never know what you may find that you're interested in from your rotations and clinical sites during the program. but you will get exposed to as much as possible, so that way you are able to work in a variety of settings after the program. So it's a wonderful way to get a good breadth of knowledge as a professional. So the list here that you'll see on the screen are the common prerequisites, and prereqs are courses that need to be done before applying to a registered nursing program. So these registered nursing programs, as I mentioned, are impacted. So students need to actually apply, submit an application packet with all their information. But part of that is completing a certain set of classes. And what I've listed here is not everything, but it's the most common requirements for registered nursing. So I'd just like to share this so that you can see what are going to be the common requirements for RN programs across the board. Sometimes you see some programs require a little less. If it's an ADN program or if it's a BSN program, they may require a little bit more. But you'll see here that composition, English composition, a speech class, that is public speech, critical thinking, statistics, not calculus, not algebra. It is statistics. That's the math for registered nursing. Human anatomy, human physiology, microbiology, and chemistry are the core sciences for registered nursing programs. These are going to be very key sciences, and these are sciences that are looked at very carefully by nursing programs, including ourselves and others, where we will calculate GPAs from sets of these classes here, and how you do in these particular classes is key. And so on top of the sciences, you'll see psychology and sociology. These are common additional requirements for the for RN programs. That could be an intro to psychology, or what we call lifespan or developmental psychology. So you will see sometimes some nursing programs want both psychology courses, just one or the other, and you'll see that range. But more and more in the field, even though it's not a requirement, ADN programs such as ourselves, PCC, and others will have will want to incentivize students to complete as much of the requirements for a future BSN. And why do I bring that up is that some of the classes listed here are specifically for transfer for BSN. That's statistics, that's critical thinking, that's some of the psychology, sociology to finish out general ed requirements as well. And there's additional courses from this on top of this list. But you will see that some of these nursing programs, such as ourselves, will require students more and more to complete additional classes and give students extra consideration into the program by completing these. So there's going to be more and more of a push from ADN programs to have students eligible and ready for a BSN so that they can complete their BSN after completing our program. And we'll get into that in a bit. But I just like to share this, these are common requirements. And another thing that's kind of some of the misconceptions is that, oh, you just really want to do well in the sciences. For nursing, you need to do well across the board. That is this English class, speech class, critical thinking, stats, the psychology, sociology, even when it's a class that doesn't seem applicable to nursing, because your GPA can be calculated in a lot of different ways, meaning you can have a GPA calculated from any of the classes here to a cumulative GPA, which would factor everything. So GPA is huge. And so it's very, very important to always keep that in mind. We also have in registered nursing programs, really quirky, funky rules with these courses, meaning sometimes as you get into registered nursing and you meet with the counselor for nursing or go as a pre-nursing major at a university, you'll be informed of the unique rules with these classes, such as you can't repeat these sciences. If you repeat some of these classes, that could possibly impact your eligibility or competitiveness. There's expiration, meaning if they're done a certain time frame, they may not count. So there's all these unique rules, which you don't have to worry about, but it's important to know that because of how competitive it is, you want to put yourself in the best position possible to do well and focus on these classes at whatever pace works best for you. These are some of the clinical sites for our students, and I wanted to show this because these are our students during the last 2 years. During the pandemic, it was a very challenging time for registered nursing programs, including ourselves and others. We saw programs had to pause, could not admit students. We were fortunate to keep our students progressing, and we had no pause in our graduation and admission of students from 2020 to now. We were able to maintain our clinical sites. You'll see Pomona Valley there, Corona, and others. We go the furthest, I think, east is Pasadena, but we, not east, west, and then furthest east would be Upland or so, and then further south, Corona. But I tell students for any community college registered nursing program, most clinical sites are going to be as local to that college as possible, but there are always exceptions. There are times when we have clinical sites beyond that area. We have sometimes clinical sites in Orange County to sometimes in LA, and that is possible. And clinicals is where a student will really get the experience to interact and treat and care for patients under the supervision of a clinical instructor. So these are all our students at our different clinical sites, not all of them, but a few, but I always like to highlight that we were able to continue on through the pandemic. And so this is where our students go in for 10, 12-hour shifts. They may be going from 6 a.m. to 6 p.m. Sometimes the shifts are overnight, because our clinicals are based on what's available at our clinical sites and what they're able to provide us, whether it's a hospital or a skilled nursing facility. A lot of our clinical sites are hospitals, whether they're city or regional. And so, because of the pandemic, we had to be flexible and, just be able to provide what our students, or provide the students what we were given. And so, but we were lucky in being able to continue with our students, but it was really great to see our students be able to progress while we experienced the pandemic the last 2 years and complete our programs. But you'll see there in our logo, it's not an old, our program started 2007. We really have only a little bit over 10 years of graduating classes. So we're fairly new compared to other colleges. This chart here is something I show in our nursing workshops and with students, because this is every imaginable way to become an RN in California and receive advanced training or certification, depending on what career goals one may have. So you'll see at the top there, Citrus College, but you can substitute that with any community college, whether it's like a Pasadena City, East Los Angeles, Chaffee, Mount Sac, Rio Hondo, I mean, you name it. You will see any community college, for the most part, being able to offer a lot of these classes. But going at the top, you will see the first row of LVN, or our program, the registered nurse ADN, or students from our community colleges, like any community college, can transfer directly to a BSN for 2 to 3 years. And I'll touch on that in a bit as well. And now we're seeing students at the furthest right of the column where it says college graduates with a degree in another field. We are seeing students with bachelor's degrees in other fields. That could be psychology, that could be history, that can be a science, that want to pursue nursing. And so they have a variety of options too. They sometimes apply to our program as an associate degree in nursing program, or they may apply to what is called right underneath that box of college graduates, an accelerated BSN, or even now what's an emerging one, primarily in the privates, and what we call an entry-level master's program as a pre-licensure program. And so you'll see here a variety of ways of where a student can become an RN. And so that's from completing our program, an ADN, to completing an LVN program first, and then pursuing the RN program. And you'll see there the different timeframes that it can be for the different programs. But a lot of our students more and more are pursuing the BSN after the program or during the program as well. And I'll talk a little bit about that as well. But we will get, a lot of students curious about, I want to become a nurse practitioner. And so I like to show this because that's going to be post-bachelor's. Again, you don't specialize until after your bachelor's. So you can earn a certification or a master's in a lot of those teal colored boxes there, whether it's a nurse specialist, clinical nurse practitioner, midwife, leader, administrator, educator. I mean, there's so many others that are growing more and more in this field, but the specializations, again, are post-bachelor's. And so your bachelor's and ADN will be more specific to the training that's required to take the NCLEX, as well as some other courses in leadership and community health and maybe some special populations and evidence-based practice. So it's very, very different. But I like to show this for students who, maybe have particular goals. And now we have a growing doctorate for nurses. We have some of our faculty in our program who have a doctorate from the program at Cal State Fullerton. And so you will see that more and more growing. But, this is just to show that there's a lot of different ways to pursue registered nursing in California. And so there is no just one traditional way. There's a lot of different ways to obtain RN licensure in California. And so you'll see all the different ways. So whether you start as an LVN and then pursue an ADN, or you want to go straight into a BSN, or you want to go up to a program like ours in the ADN RN program and then do a bachelor's, or maybe you want to apply directly to a Cal State for a BSN, not go through our programs. You'll see that as well. And then we'll see students who are former graduates with bachelor's or outside students with bachelor's degrees now pursuing nursing. So we see a variety of students in community colleges such as ourselves at Citrus College. So I mentioned that in our program, in the ADN program, which is 2 years for the traditional students and 1 year for the LVNs. So our LVN students will complete the program really quickly in a year, and our traditional students are there for 2 years. So while they're in the program, we encourage them to start exploring the BSN. And while the RN program that they're in with us will give them the licensure, we encourage students in our program to pursue that BSN for employment opportunities. While our graduates will be working, will find work after graduating, we find that more and more RNs are going to be moving around. There's few areas in nursing that, we have people just staying in. We see a lot more mobility with health professionals and especially RNs moving around to different employment sites. And so because of that, we see that some hospitals with magnet status, which is, a national recognition of nursing practice, and more prestigious research-based hospitals may prefer and hire only BSN educated RNs. We will encourage our graduates who will have an associate's degree to complete that bachelor's. And there's a couple of different ways they can do so. So they can complete parts of that program while they're in the program with us through something called a dual enrollment summer bridge class. So while they're in the summer in our program, they can actually take classes with schools that we have partnerships with, such as Cal State Fullerton, Azusa Pacific, Mount St. Mary's, and National University. And so our students have an opportunity to actually take BSN courses while they're in the ADN program. And so that gives them a head start to when they finish our program, they'll be able to complete the program with less classes after, because these RN to BSN programs are 1 year typically, usually 2 semesters. But we are seeing now more and more of a new pathway that's emerged for ADN students that are more concurrent enrollment programs, meaning students who start the ADN program like us, our RN program, will be able to have the opportunity, if eligible, to complete and work towards their BSN from the start of their ADN. So what that means is we will have students now more and more in ADN programs having the opportunity to complete an ADN and BSN by the time they finish their ADN program. And so we are starting to see pilot programs in our area from some community colleges. Some of these are with Cal States. Some of them may be with privates. We're working on one right now with Azusa Pacific in developing a plan for that. And there is one happening with San Bernardino and Cal State Fullerton at some schools towards our area that's starting to grow. And again, that is a concurrent enrollment, meaning that a student who starts our RN program would be enrolled in 2 schools, essentially. Our program and then possibly another university for their BSN, whether it's Azusa Pacific or if we create one down the road, one with Cal State Fullerton, as it seems like that's the trend. And that's to, again, incentivize and push for our RNs in California to be BSN educated and trained. So there's a lot of things growing and a lot of trends in nursing education in programs. So we're seeing a lot of things, and these things change year by year. But these RN to BSN programs are typically online. They're not necessarily in person a lot of times. So a lot of flexibility comes because it is for students in an ADN program or for graduates in an ADN program, meaning they'll be licensed RNs. So they're not always able to come in person on campus for classes. So these RN to BSN programs are a lot more flexible and are a lot more flexible in their admissions. These are not pre-licensure BSN programs. And I stress that a lot because pre-licensure means essentially pre-nursing. You get in and now you're in the program officially. Now you're a registered nursing student, but you're being trained to get your license. These RN to BSN are under the assumption that you will have completed the program or you're in an ADN program that will lead you to the completion of that RN licensure. So because of that, these RN to BSN have a lot more flexible admissions. And this is one of the biggest reasons why students pursue ADN, is because there's more ADN programs in the area in Southern California. There's close to 30 if you count Ventura, the High Desert, and even a little bit south of Orange County. There's a lot more ADN programs than BSN programs on public institutions, I should say. And so because of that, we see students pursue the ADN, and we have more ADN trained and educated RNs. That's just the reality of where we're at. And so because of that, there's a push for the field to, have our students complete the BSN. And so these are the many ways that we can accomplish that. And those pictures of our students where we bring in our representatives from these universities to talk to our students about their RN to BSN partnerships. Now, I've mentioned pre-licensure quite a bit. Our program is a pre-licensure ADN program, but there's also pre-licensure BSN transfer programs, meaning let's say you go to a community college like us, Pasadena City, Mount Sac, you name it, but you're not necessarily interested in pursuing an ADN program with us. You may pursue direct BSN transfer. And so that is a possibility where students can attend our community college for 2-3 years, whatever the length of time it may be for students to complete those requirements, and then apply directly for a BSN transfer. However, as I mentioned earlier in the previous slide, these programs are not only impacted, but there's less of these BSN programs for transfer students, especially at the Cal States. The Cal State pre-licensure BSN is probably some of the more selective and admissions around. So you will see Cal State LA, Long Beach, Cal State Fullerton just opened an upper division transfer, Cal State San Bernardino, you see the UCs. These programs can range in the amount of students they admit. And so each program admits a different amount of students for transfer. And so because of that, that can impact tremendously the impaction and the competitiveness. So these programs are very competitive to get into, especially for public schools, such as the Cal States and especially the UCs, as there's only 2 UCs with pre-licensure programs, UCLA and UCI. So that's why you see the majority of these pre-licensure BSN privates and Cal States. These programs can range in 2 to 3 years upon transfer. At Cal States, a lot of them are 3 years. For privates, that can be different. Those can be closer to 2 years. But these pre-licensure BSN transfer programs are very competitive. They have very strict requirements, rules for admission. You have to take an admissions exam, which will be commonly known as the ATITs. And so you will see that a lot more. And so it's something to really keep in mind. What I tell our students on our college is that, you complete your requirements for both a possible BSN and ADN, apply to, as many of each pre-licensure BSN and ADN, and then just see what happens, cast that large net and then allow that to help you make that decision. So I always encourage students to explore both and then see from there what can happen. But there are fewer pre-licensure BSN programs, and these are very, very competitive some of these programs are receiving an enormous amount of applicants for a limited amount of students. And so on the last slide of this PowerPoint, and then I'll transition over to our website, because I find that is very, very important. Some important tips for pre-nursing students who are really considering this as a field is community colleges, more and more, they've developed healthcare career exploration courses. I understand that there's students here possibly with courses that are already focused on some of these. So that's great. That's one wonderful good step to help explore that and get a better sense and exposed to what, you know, those could be. But there are others at community colleges now. We have them, careers in healthcare careers. We will have one in specifically nursing exploration as well coming up in the near future. And you'll see that more and more at community colleges in case students are still, you know, wanting to explore careers. It's important to research as you're trying to explore this. There's so many programs out there on billboards, radio ads, TV ads of health professions, because it's such an in-demand field, but not all programs are the same. And so it's important to really see which one's approved. As counselors, we can assist with you with that and verify and check if, you know, this program is indeed approved and what can happen, because there's a lot of layers to these programs. Research healthcare experience. If you haven't done so yet, you know, even shadowing and observing professionals in the setting will give you a sense of their pace, the day in the life of a nurse or health profession, to get an idea of if this is a fit for you, the lifestyle, the work schedule, the conditions that one works under, if that will be something that, you know, you want to pursue. And so it's a wonderful opportunity. Volunteer experience can be really tremendous. Co-Health Scholars is a big one, but a lot of individual hospitals have a volunteer program. That used to be, you know, those were paused in 2020 and 2021, a lot of them because of the pandemic, but are starting to now reemerge. And so that's a wonderful opportunity. With volunteer experience, I usually encourage students to explore those that will allow you to interact with patients, because that will get you more and more comfortable in that particular setting and get more experience with direct patients. And so that's very, very helpful. And if not, professionals such as a CNA program, EMT program, they're not long-term or long programs, I should say. They're quite a bit, they're short in training and can be very valuable for future registered nursing applications. Study habits. You got to start developing that, because nursing programs and health programs emphasize on critical thinking skills. And so, and this happens with our students, even when they've done their sciences and things. It's a big transition into any nursing health profession. These programs are very strict and are rigid, and that's all because they're governed by a board, as well as trying to, you know, produce professionals after graduation. But the testing that comes to these fields is not going to be similar to the testing that you have in undergraduate classes and things like that, where you may have multiple choices, questions, and then usually, you know, you're able to filter and screen out a couple answers that are not usually, as an example, not applicable to that question. That's not the case with what we call NCLEX style questions. And that's because they want to see, how do you apply your knowledge to real life case studies? And so that requires critical thinking skills. So how you develop that is very, very important with maybe a career class, maybe through the courses you're doing right now. That can be great, but that will be important because in these fields, in order to be licensed, these kind of questions in your classes and the nursing program will have multiple choice questions and have answers that can technically be all correct and applicable for that patient in that scenario. It's deciding on which one is the best applicable for that scenario. So it is very different. Keeping up your GPA, that's huge. GPA regardless. So sometimes that may mean students can attend full-time, and sometimes students may need to attend part-time at our community college. That's the flexibility that it comes with community colleges. At universities, you know, you'll have an advisor. You likely have to be full-time, but they advise you based on, you know, how to ease you into the program there, or the requirements as a pre-nursing major. Taking the right courses. That's why I had an earlier slide of classes. I see it all the time where students take courses that are not needed all the time, whether it's an incorrect science, a speech class that wasn't the correct one, an incorrect sociology, a math that was not required, things like that. So always make sure to follow up with your advisor or counselor at your respective college or university as much as possible so that you are taking the correct classes, because it's going to be very, very important for your success. And what you see up on the screen are the different governing boards for LVN, RN, and CNAs, the BRN for RNs, the BVMPT for VNs, and the Department of Public Health for CNA health fields. And then Co-op Health Scholars is our volunteer. I'm going to take a moment to stop share. And I want to show the website because that's where I guide a lot of our students for information on programs. Here we go. So the website, our registered nursing website should be loading up if it hasn't done so already. This is our registered nursing website. There's a lot of information here. You'll see here our application period just had closed back in March, but there's a lot of information here. We have occupational guides on registered nursing, on what they do, everything, the salary outlook and things like that you will see here. So we have links to that. Our pass rates for NCLEX, for a licensing exam, are a direct link to the BRN. But more importantly, you'll see the requirements to a program like ours, advanced placement, generic, the traditional. But this thing here, I wanted to really emphasize, and I won't go too far into it because it's very nuanced and there are a lot of layers to it. But registered nursing programs at community colleges and universities use a lot of different ways for admission. So because of how impacted and competitive it is, some programs may use something called a random selection lottery system. They may use a wait list where you apply and you just are going to be told how long it may take for you to wait until you're officially admitted. That could be quite a bit of time. Or a point system, which is commonly referred to as criteria, and students get points for different things in their application. So I just wanted to show briefly what ours is here at Citrus. This is the tool we use in evaluating and reviewing nursing applications. But I also wanted to show you that this is common, for example, for PCC, for their registered nursing program, they have criteria here. This is their point system. So you will see ADM programs, community college nursing programs, use a point system, and they get points for all sorts of things. Your GPAs, do you have maybe a CNA certification? Maybe an exam score such as the ATITs? Are you the first in your family to attend college? Do you speak another language? They use a lot of different circumstantial, academic, healthcare-based certifications and experience categories to rank applicants. So you'll see that across different areas. So you will see that schools use a variety of different methods to admitting their students. You'll see here too. This is Mount SAC. So you'll see that a lot of community college nursing programs will outline how they rank their students on their website. So as you go further and further into, looking into the nursing field and maybe considering ADM programs, once you meet with the counselor, you'll start seeing these things and you'll see what is it that they're looking for. And so you'll see that a lot more across ADM programs. Private universities and Cal States, we don't always get a sense of what they use in terms of how much they weigh certain categories. That's something of an internal practice just because of how competitive it is for those Cal States and privates, but they do outline the requirements, but we may not know how much something weighs in their decisions. That's just something we're not privy to. But for ADM programs, you will usually see that. And so you do see that. And sometimes you'll see some RN programs use a combination of a criteria point system mixed in with some random selection. And so you have seen that more and more with ADM programs. But it's always good to just check out the RN website of any particular school you're thinking about, and you'll see a lot of information. There's a lot of stuff usually in these websites. So it does take some time, but do so that you get a better understanding of the expectations, the requirements, what they're looking for in an applicant, what they prioritize, things like that. And a lot of times they offer workshops. We offer nursing workshops for CNA, LVN, and RN programs every semester. Right now, they're still through Zoom. And so it's very accessible. We have them in the evenings, but a lot of nursing programs do. And so at community colleges, so they'll have info sessions. Just check one out whenever you'd like to get more information on the program. And that way that will help with, making your decision as to what schools or, whether that's something you want to pursue or not. But I wanted to take time to share that because there's a lot of information on these websites, and it's just important to start, exploring some of these websites as much as possible to get that necessary information. That concludes my portion of the presentation. I don't know if we want to now open it up for questions, Elizabeth.
Yeah, definitely. So give me 1 second. So here are some questions that students submitted ahead of time. And just to reiterate, what is the cost of the LVN program?
So specifically for our LVN program, we require two things mainly: CNA certification, nurse assistant. So a student has to be certified as a CNA, and they have to enroll in what we call the Nursing 100 course. And so we have two ways to do that. I'm gonna just pull up our website. This is our vocational nursing webpage, but CNA is a certification that you have to complete a program through, and you get a certificate. So that needs to be one proof in order to be cleared for the Nursing 100 class, which is the Intro to Vocational Nursing, which will be how students are admitted in the program. The top performing students are selected from their performance in Nursing 100 Intro to Vocational Nursing.
And the next question is, what is the percentage of students who pass the NCLEX at Citrus?
So let's go back here to our class NCLEX pass rates. There was something that we had to update because they had a number. I don't know if they still fixed it. Did they? Okay. So this is our row. Well, let me go back right here. We're a much smaller program. So we've had it in the 90s to the 80s, essentially, just from the last couple of years. So when comparing to the program, I always tell students, we usually only have an average of around 30 something taking the NCLEX on a yearly basis. And so a few that do not take it can impact that number tremendously. Also, these NCLEX passage rates only reflect when the student has done it for the first time, because the student can take the NCLEX after not passing, pass it, and it will never reflect here. These numbers only that reflect the first time they've ever taken the NCLEX. So just keep that in mind when comparing programs. You'll see some fluctuation. It's like, wow, that program has a lot of students. So the fewer students that are not passing it has a less impact on their percentage. So it's important to, compare that with similarly sized programs. But overall, community colleges and privates are fairly strong in that. But that's ours for the time being. We're a much smaller program.
Great. Do you also know what percentage of students found a job within 6 months of graduation from the nursing or other
100%.
health science? 100%? Awesome.
Yeah, all our ADN students will get hired. The consideration is whether or not they want to work at what we call a magnet, prestigious, research-based university hospital. And so those hospitals may be more selective. Our clinical sites are usually available for our students if they want to, if there's openings at that respective hospital. It also depends on their interest. And so for an example, we get a lot of students who want to do maternity, prenatal, and in those areas, typically there's not a lot of movement. People stay in those sections, so students may have to move around. But in other areas where there's need, especially psychiatric nursing and gerontology, it varies. But all our students will find work. We do a 6-month survey after our graduation.
What about for the other health sciences programs that you offer, like home health aide and EMT? What percentage of those students find a job within 6 months?
It's 100%. In fact, we get employers who are waiting for our graduates.
Oh.
And so CNAs are in high demand, especially in home health setting. Home health aid, we only offer based on if there's enough CNAs who are interested in taking it. Home health, those are the ones that are more traveling to individual respective residencies to provide patient care. So we don't always see as much of a demand for that. So that's why I didn't speak on it too much, because we don't always offer it regularly, but CNAs are hired right off the bat. Some work in the hospital. We have a partnership with Intercommunity, which is in Covina. And so a lot of our students will go there, or if not, they do home health, like at a SNF skilled nursing facility or another type of home health setting. And our EMTs as well, whether they work with like an AMR employer, we have a couple of partnerships with that, and they do some ride-alongs with hospitals as well. And so those students will also find work. There's just a lot of demand for them.
I'm not sure if you have the data for this one, but do you know what percentage of students who completed the RN program transfer to finish their BSN?
So we don't have exact data on that one, because 6 months, we find that not all of our students are going right into the BSN. So that's why we're now seeing more programs, BSN level programs, trying to create partnerships with community colleges to complete it while they're in the ADN. So we don't have an exact percentage of that, but we do have quite a bit of students who do our summer bridge while they're in the program, but that doesn't mean they start right off after 6 months, because they are into BSN. They can start that program. Usually they have openings, application periods 2 times or so a year, sometimes even more if it's a private school. So after 6 months, they may have not been in an RN and BSN, enrolled in an RN BSN program, but they may in the near future. But we don't unfortunately have data on that.
Okay, that's fine. Speaking of transferring, can you speak about the differences in transfer rates between community colleges? Why are some community college transfer rates so much higher than others? And does that mean that the community college with a higher transfer rate is better to attend? Or does it all depend on the student more, and a hardworking student should be able to transfer successfully, so the community college transfer rate doesn't necessarily matter as much? Sorry, it's a long question.
Oh, no problem. So transfer rates is really influenced by a lot of factors: the size of the institution, the local schools that it's associated and partnered with, and also major. So with nursing, I'm very honest, it does not matter which community college, because nursing is going to be competitive across the board, especially in our Southern California basin, whether you go to Moorpark College in Ventura County, College of the Canyons, Victor Valley College, Palomar, Acosta College. All these programs are highly impacted, and that's because it's so competitive and popular. So that transfer rate will not be applicable to nursing. When you see certain, community colleges boast transfer rates, because that's incorporating all the majors. Nursing is just competitive across the board. So to give you an idea, Acosta LA admits about 70 students for their BSN transfer, up to 70. I say up to because it's not always that student. They get close to 1,000 applications for once a year. So if we just divided that, that's gonna not leave a very 7% admission rate. That is very low compared to other majors, which could be from a UC to a Cal State to a private. So nursing is very different, and so is health sciences compared to other majors when you see transfer rates. And, of course, we hear them because we see the ads are everywhere. PCC and Santa Monica College, highest transfer rates to UCLA and USC. We have to keep in mind, USC doesn't have a pre-licensure BSN program, and UCLA's only admits 10 to 20 students once a year. So it's other majors that, they're factoring everything else. So, it really, to me, depends on the student. It's the student and what they put into it and what they're investing in and to putting themselves in the best position possible to apply to nursing programs and health programs. Nursing is just so different compared to other majors.
Yeah, good points there. Let's see. I lost my question. Are any of these programs available completely online, and can a student become certified for one of these programs while they're attending a four-year institution?
Oh yeah, so some of these programs, I'll go back. I'm gonna stop sharing the website so I can go back to the PowerPoint. Because these health science programs require certain hours to be done with actual patients, they're very difficult to be done online. Does it mean you can't do them while you're in a university? A lot of these can be done over a summer. We get students who are attending Cal States and private schools and universities, UCs, who attend our schools and community colleges across California while they're off, whether it's a winter or a summer. Some of these classes can be offered, CNAs offered in the summer, EMTs offered in the summer, that are short-term entry-level health profession certification programs. Those you can do, but there's an in-person requirement because you have to do a certain amount of hours with patients. So unfortunately, it can't be done online.
And students, just a reminder, if anyone has a question, feel free to raise your hand or let your teacher know, and then, you can ask your question. Another question that we got when students RSVP is it possible to complete any of these certifications while a student is still in high school?
So that's a very good question. I know that there's some programs that can be done. We've seen students who complete a home health aide kind of program under 18. We know that some of these can't be done for students under 18. EMT cannot because of the background search component and some other requirements with acute settings such as hospitals. So it does become a little bit challenging. If the program works with SNFs, skilled nursing facilities, they can sometimes have different requirements than acute hospitals. I mention that because our programs work with hospitals and they tend to be a lot more strict with what are the requirements for, especially during the last 2 years. And so we commonly find that they require students to be 18 and above. But there's sometimes programs that are like CNA and CMT at other places that will allow students sometimes to start the program before they're 18 because of where their clinical practices are. So it also depends on that, but ours are a little bit more strict with that.
Okay, so at Citrus specifically, the only one that from the health sciences department that students under the age of 18 might be able to complete is the home health aide?
Possibly, but that requires CNA certification for us.
Okay.
So a student will need to have done a CNA at our school. That's not always the case at others, but it becomes difficult, with that in mind. And so, we see students who have completed credits through ROP programs or the Unique Health Academy programs. And we do see that, but at our campus, it's typically 18 and above.
Okay. And let's see. How much will high school GPA be considered during admission into any of these health science programs?
Oh, good question. No, it's not going to be factored. So your GPA will be once you start post high school for these programs. So if it's a registered nursing program, whether it's a vocational nursing program or other allied health profession, your GPA that is being viewed at is your college coursework, not high school. You may get credit if you've done courses while you were in high school at colleges, or if you completed advanced placement exams for certain courses, but the high school GPA itself will not be a factor.
Are any of these programs possible to complete over one semester?
The CNA and the EMT, those are the shortest that we have available that can be done in a semester. Our semesters are 16 weeks. The EMT is 16 weeks and our CNA is 8 weeks. So it's even shorter than that.
Okay. And then, so that means that it's possible to complete it perhaps over summer semester too?
We have the CNA that's 6 weeks, so it's even more accelerated than our regular semester course. So it can be done. Yeah, but it is intensive because it's 6 weeks, 5 days out of the week, Monday through Friday, 7 a.m. to 2 to 2:30 p.m.
And is it possible to switch programs? Like maybe someone is doing like CNA, and then they decided that they want to switch to like RDA.
Oh yeah, absolutely. That's the wonderful thing with community colleges. Students are able to change majors, work on multiple different career goals and educational goals. So we see students move around all the time, from CNA to RDA, or they decide to do dental at first, but then switch careers to pharmacy, pre-med, chiropractor eventually, or something else, even nursing, or even another health science field, even pre-physical therapy. You know, we see that quite a bit. Not all have the same requirements, but you know, there are some overlap in requirements that sometimes that, you know, won't impact the student. But yeah, students are able to move and transition from different majors.
And is there one question was, do we have to commit to an internship or job within Citrus for a certain amount of time if we were to take their program? Are there any like internship placement or like job placement while they're completing one of the programs? Or it's just
So,
part of like clinical and rotations kind of thing?
so some of these programs like the RN and the LVN, and I'm glad that was asked because it brings up this very important point. These are full-time programs that's very difficult to work along with these programs. So RN, especially in LVN, they're very intensive because of the theory, the amount of clinical hours and skills lab practice that one has to complete. Because of that, we don't find a lot of our students working, and if they are working, they're working part-time. The program itself does not assist with job placement during the program, as its focus is to prepare you to complete the program itself. So we find that if a student who was a CNA, as an example here, gets into our RN program, they may work as a CNA or even an EMT on a part-time basis while they're in the RN program. That is one of the reasons why we encourage also CNA, EMT, or other healthcare certifications prior to applying to an RN, not only to help your competitiveness, but it may also help you, you know, work while you are pursuing your RN program. But an RN program and an LVN program are very heavy in the amount of work and coursework and just work outside the class that's involved.
Okay. Next question is, how hard is it to get classes that you need to complete one of these programs? And, you know, other than the nursing, are they all impacted as well?
So yeah, let me go to the page with those classes right here. So for the most part, a lot of these classes now, because of the pandemic, have been now widely offered as online classes. For some students, that works great with students who have other commitments, responsibilities, and circumstances. But the classes that have been historically a little bit more hard to get into are the sciences. That's anatomy, physio, micro, and even chemistry, but in particular, anatomy, physio, micro. And the reason being is nursing is not the only field that requires this. Kinesiology majors, dental hygiene majors. And so we'll see other majors who need these classes as well. And we get students from different areas. The sciences, you'll see a lot more in person versus online because of the lab component. So we may see that there's more flexibility right now. Right now, I would say it's not as hard as it was pre-pandemic. I'll be very honest with that. We have seen that enrollment has been down across most community colleges in Southern California. And so we are starting to just see maybe students coming back in general, whether it's online or in person. So in the pre-pandemic, the sciences were tougher to get into, but we found that in this last semester, we had openings in these sciences, and we had students attending these while in the pandemic virtually, which made it easier. But as the sciences are coming back in person, because health programs very uniquely sometimes will require students to do these sciences in person. And so to give you an example of an advanced field is physician assistants. A lot of students will express interest in that. Some of those programs don't allow any science to be done online. So we've had students who never took sciences these last 2 years because of that. So they're going to come back starting now, moving forward for some of these health professions, or took them only where they were able to do it physically. And so, you know, typically the other classes that you see here besides the sciences are not challenging to enroll in. What you might see that's a little harder is the anatomy, physio, micro. But I'll say this, once you're enrolled at a college, once you have more time there, you will have a better registration date, and then you will be able to get into the sciences. Typically, students don't just jump right into these sciences, nor is it always recommended if you're brand new because of what's at stake with these grades. But if you're a brand new student and you want to enroll in one of these sciences, that may be where it becomes more of a challenge. But once you're in a college and you already been there a few terms, you will have a good registration date to get into those sciences.
All right, and the last question before we end for today is, do you have any insight or advice for students who are trying to contemplate between like a private, you know, career college versus a community college because they're worried they won't get into a, you know, one of the health sciences programs or the classes that they need?
Yeah, you know, when students are exploring private schools versus public schools, I always encourage students to be really, you know, smart consumers, you know, just like you would for anything else, because of the amount of money that's involved in these programs. We get it all the time from our students, especially from, you know, a West Coast university that is WASA accredited and board approved, but they operate differently. And the high cost, 6 figures. And so I always encourage our students to attend an info session or meet with a nursing advisor there first before you make any decisions, see what it would cost. And one of the bigger considerations with private schools is what kind of a private school. We have nonprofit privates, Mount St. Mary's, Azusa Pacific, Loma Linda's, versus for-profit, the West Coast, the San Joaquin Valley College, American Career College, Glendale Career College, nursing programs that operate very differently. What I would always encourage students is to try to complete, regardless if you're pursuing private or public, complete your prerequisites prior to applying to those private schools. I would not recommend completing any class that you see here on the screen at a school, as at a for-profit private school. So what I mean by that is if you decide you want to do an English there, you do your sciences at American Career, but let's say you don't complete the RN program there, the challenge is moving and transferring those courses, and those will likely not transfer over. And so it's going to be on a case-by-case situation from the school, whether it's WASC accredited or not, but it becomes a challenge to transfer those. So investigate all the information, the cost, the length of the program. Some of these private schools run much more accelerated. So their scheduling is more on like a 10-week quarter system versus semester. And so they are year-round and at a faster pace. For some students, that's great. And for others, it may not be a fit. So you want to inquire about all of those factors before committing a large sum of money that you will take out a loan on a school that if you do not complete, it will be sometimes challenging to start from that point where you did not finish and start at another nursing program. That's a challenge in and of itself. So research as much as you can, attend an info session from that school, meet with them first, get as much information as you can before making that decision. But there are differences between those private schools.
All right, thank you. That was our last question. Does any of the teachers have any questions from their students before we end for this day? Doesn't look like it. So I think you covered a lot of good information. Thank you so much. And everyone have a good rest of your day. Take care. Bye.
Thank you.